has 17 total patients, with 13 active and 4 in that recovery period. And then we also see Children's Mercy has increased by 4 over the last 24 hours. They have 18 positive inpatients at their facility as well.
All right, Doc Hawk, thanks for that update today. Do we have any reporter questions on the line? Okay, I do have one from Matt over at KMBC, and he is asking a question, Dr. Hawkinson, that we do talk about quite often, but if you could just go over the advice that you're giving J&J vaccine recipients when it comes to that booster dose. That's a big question. Is it okay to get that mRNA if they've received the J&J? Yeah,
so there's a lot of questions there. We had an email that I sent out. There was a question about that. We were discussing with some of the physicians and executives yesterday, and actually walking in was talking to an executive as well, one of our other employees who knows people who got J&J, and certainly that is a big question. We know that the people who did receive the Johnson & Johnson Janssen vaccine kind of do feel left out a little bit, just because there is a paucity. There is only a little bit of data about that, and certainly not to the extent or the duration, because it hasn't been out as long. What we are expecting, and what I saw from the CDC, is that within the next few weeks there should be more information about that, especially looking at durability of that protection that Johnson & Johnson vaccine provides. So the question would be, well, what will happen if they do offer, or if it is recommended that you get an extra dose after Johnson & Johnson vaccine? Is it going to still be Johnson & Johnson vaccine, or will they say switch and pivot to an mRNA vaccine? So that is just the information I don't have. I don't know if there's unpublished studies. Certainly we have a little bit of information from the United Kingdom about AstraZeneca and Pfizer. So AstraZeneca is very similar to the Johnson & Johnson vaccine, and then giving the Pfizer dosing. But overall, that is a large question, and I think what we have been told to expect is that within the next few weeks they will have more information for us, more guidance for us, for those of you that have received Johnson & Johnson vaccine. However, I would note that there were 2 recent publications from MMWR, the CDC publication, looking at vaccine effectiveness. And all of the vaccines that are currently used in the United States, the 2 mRNA vaccines and the Johnson & Johnson adenovirus vector vaccine, all look to continue to give very good efficacy in protecting you from going to the hospital from severe disease and death. So right now, if you did get Johnson & Johnson vaccine, that is the main messaging, and that is supported by pretty good evidence right now, and that includes 2 recent publications that were just published this week showing that even up to 24 weeks out or more, you still have very good protection against hospitalization, even if you receive Johnson & Johnson vaccine.
Yeah, we hear a lot from those folks that they feel like they're kind of left in the dark with this information, but it's coming. So just be patient and wait.
And I think, I think that the 2 recent publications, I actually have them here, I think that should give some comfort to those people.
Good. All right. Thank you for sharing that. Okay, so it is Follow-Up Friday. We've got some great questions lined up for you. They've been coming in through the week, but send in your other questions now, because we're going to try to get to some of those as well. And we're so glad to have Dr. Tim Williamson with us. We're going to talk patient transfers. And I just want to jump right in and talk, Dr. Williamson, about our transfer center, and then let's just get straight to the numbers. What are those looking like? What have they looked like?
Yeah, good morning. And so we're very fortunate that we have, for the past several years, had our own transfer center in-house. We used to outsource that, and we do that completely in-house now. We historically have averaged about 800 or 900 transfer requests a month. Back in November of last year, we hit a record height of 1,200 requests. In July, we broke that. You can see a graphic here. We got 1,500 requests in July. What has changed in July, because of the volume, because of constraints on capacity, we ended up not being able to take about a third of those, so we weren't able to take about a third of those. But the past few weeks, it's been like nothing I've ever seen, and we actually are currently on pace to be over 2,000 requests for the month, which is just the highest number that we've ever seen. Along with that, because of the very large number of requests, we are currently only able to accept about 30% of those, or slightly less. So we're having to decline maybe 70% of those, just because of the sheer volume doesn't match up with, our capacity. And that doesn't really probably take into account either the very large number of calls we get that are just very quick, do you have this type of bed? This is really only those that we get information and go through the process, so which we can talk about in a second. But.
Right, and turning away one patient has got to weigh really heavy on your team.
So it is weighs incredibly heavy, and that is a really great group of nurses there. We have typically 4 nurses during the week and a couple on the weekends who are interacting with the referring facilities. Then we have physician advisors. There's 3 of us. I'm one that helps with that. And then a couple of others that then what we try to do is we try to match that patient's needs, and we evaluate it in the real time as they come in. Do we have what that patient needs? Do we have the capacity to take care of that patient? Do they have the capacity to take care of the patient where they're at? And then try to match all of those things up. And it weighs really heavy when we have to say no, because we know that patient will likely remain at that facility because everyone in the metro area, everyone across Kansas and Missouri, and really across a good part of the U.S. is in the same place.
Well, it's really concerning when I hear you say, I've never seen anything like this before. That's very scary. So how often are we evaluating this? I mean, I would imagine 24 hours in a day, you're doing this really up to the minute, right?
We're doing it in real time. We're doing it minute by minute. We have constant updates in terms of our capacity, but really every single call comes in. We match that with our capacity at the moment, and so it is a very fluid situation. What things look like at 8 in the morning may be different at 4 in the afternoon, which may be different at midnight. And so it changes very rapidly.
Other hospitals having the same issue?
Yeah, absolutely. And so pretty much to my knowledge, all of the hospitals in the metro area are constrained right now by capacity. And it goes back a little bit to the numbers that Dr. Hawkinson shared. I think every hospital's numbers would be higher if we were able to accept all of the requests that we get. And those requests are coming, and again, it's not limited to us, not only from Kansas and Missouri, but we have gotten requests from New Mexico, Oklahoma, Texas, South Texas, Louisiana, Mississippi, and Georgia, and Iowa, and probably others. So we've gotten requests from all over the country.
So, and you haven't really seen that before?
No.
Lately, certainly.
We saw probably the closest we came to this was back in November and December when we had the surge back then, and thought that was record numbers back then, and it was back then, but this surpasses that. And I've been in healthcare about 30 years now, and I've not seen anything like this.
You've seen it all up until now, right?
Well, I thought I had.
Right, you thought you did. So a question people often ask us is, because we're a large health system, people rely on us to take those transfers. So when we deal with the staffing issue, we have very stressed out, tired staff. They've been doing this for a year and a half. How are we balancing that out when we talk about tired staff, added patients, and making sure that our patients are getting the care we've always given?
Yeah, absolutely. And so we do continue to focus on very high quality care for our patients. We are very fortunate that we are currently able to staff all of our beds. We're able to staff our brand new unit that we opened July 26th, and we're able to staff typically somewhere from 2 to 3 alternate care areas. By this, that may be recovery areas or other places that are meant for patient care, but they're not typically what we've had to use. So we're able to staff it, but it really is hard on our staff. They're tired and they're stretched, but we know that we have to do everything we can to meet as much of the need as we can. Some of the other hospitals have definitely been stretched on their staffing issues and not been able to staff all the beds, and that leads to not being able to take patients as well.
So if we don't slow what many are calling this freight train down, I have to ask you that question, kind of what keeps you up at night? What are your concerns? Yeah,
so I'm not someone overly prone to worry, but I'm worried about, we may be seeing some slowing or flattening of cases in Kansas and Missouri, but we also don't know the impact of some of the large gatherings. We don't know the impact of schools opening. And so I'm worried about what is yet to come, and knowing that hospitals are already stretched. And I'm worried that we could see what we've seen in Texas and Florida, in Mississippi, and that hospital is just totally overwhelmed. tents being set up in parking garages. There's not much more. There's not any more give in the system right now,
Right.
and I'm globally, and so additional strain on the system will come at the expense of having to really go into those sorts of mass casualty modes, like we've seen the tents in the garages
Yeah.
in Mississippi,
And having to make choices.
and having to make choices in terms of who gets care and who doesn't.
Right. We don't want that.
And absolutely not.
And this all comes back to one thing: getting vaccinated. What's your message about that?
Yeah. The message there is simple. It's please, please, please get vaccinated. Short term, well, not just short term. Wear your masks. Masks, avoiding indoor gatherings will make the biggest difference over the next few weeks. But then absolutely, Dr. Hawkinson shared right now only one patient in our hospital is not vaccinated. That will make the biggest difference long term in terms of how we turn this tide and get out of this.
All right, we're going to get to some community questions today. I want you to help me and Dr. Hawkinson answer some of those, if you would.
Absolutely.
Okay, so let's get to our first one. And again, keep sending your other ones in today. We're going to try to get to those. But if I'm vaccinated and I'm not immunocompromised, that's a good place to be. What is the risk of eating indoors at a restaurant? Dr. Hawkinson, what are your thoughts on that?
Yeah. I mean, what is your risk of indoors for what? Getting exposed to the virus? At this point in time with the community spread, your risk of getting exposed to the virus is probably pretty high in those indoor situations, as Dr. Williamson had just mentioned. We know those high-risk areas where masks and distancing have the greatest evidence of providing the greatest benefit. So certainly being exposed and getting infected, it's pretty high risk to do that. Now, if you're fully vaccinated, is the question, what is my risk of getting disease and or going to the hospital? What we have seen, and kind of what I kind of brought up a little bit earlier on, is that we still see that if you're fully vaccinated, your chance of that whole spectrum of disease, but especially going to the hospital, having severe disease, remains significantly low or significantly improved if you are vaccinated. So I think you have to just weigh what are those risks and benefits that I want to do. Is there a high likelihood I will be exposed and get infected? Probably. But what is the chance that I will get severe illness and have to go to the hospital if I'm not immune compromised and I'm vaccinated? It still remains quite a bit lower, significantly lower than if you're unvaccinated.
Okay, so how serious are hospitalizations now compared to last year? Meaning, how sick are the patients, and what's the average length of stay?
Globally, I'll say patients are sicker, and what we're seeing is they're younger, and there are more requests for ECMO, which is a total heart-lung bypass, which is kind of the very last resort in terms of supporting someone's life. And those requests we're not only seeing in 20, 30, and 40-year-olds for ECMO and heart-lung bypass. We're seeing them I know of at least 3 pregnant or recently pregnant patients in their 20s that have needed that in the metro area just in the past week. Last week we had someone in their 30s pregnant. And so, I don't remember seeing this degree of critically ill, pregnant, and immediately postpartum patients in the last really big surge we had. So it's incredibly concerning.
Delta is different.
Delta is different, yes.
And the patients are different,
Yes.
and the amount of sickness and length is different. It's what we've been saying. The next question is, my dad would like to have all his employees vaccinated, but has an employee who refuses to get the shot because he claims that he's allergic to intramuscular injections. Can you verify if that could be true?
Yeah, again, I think if we're talking about an individual, it's very difficult to know the details of that individual and their health history. The question as it's asked right here, intramuscular injections, I'm not really sure what that means. People get injected all the time with different substances. All of the vaccines are really pretty different in what their components are and their makeup and the platform that they use. But again, right now for the COVID-19 vaccines, there is no contraindication really unless you've had an allergic reaction to one of those components or if you had a serious allergic reaction to the first dose. In speaking with our allergists and in looking at published reports about people who did get second doses, even after a reaction with the first, there tended to be less reactions with that second dose as well. So I think without knowing the full details of that question, I'm skeptical of just in general somebody who is allergic to intramuscular doses.
I registered for the Rock the Parkway Marathon back when I felt safe. I'm questioning whether I should participate now. I'm vaccinated, but my 2 children are not. What are your thoughts?
Any type of outdoor thing like that, I think the marathon itself is likely safe, out running and spaced. Probably the bigger risks, even though that's outdoors, come when you're congregated, either in activities or at the start line. So I think if you're outdoors and masked when you're in the groups and you're trying to space as much as possible from the other participants, probably reasonably safe. But my worry would go back more to any of that close congregation, even though it's outdoors.
The volume. And don't you think people are having to kind of make those decisions? Something that they may have felt safe doing 3 months ago is different now.
We totally are frequently making those kind of reassessments of, is it still safe to do this? And things that we planned even a month ago, maybe we reconsider now.
And with Delta, it's important to make those reevaluations. Would you be
Absolutely.
running in that marathon, Dr. Hawkinson?
Yeah, I think so. I think we've always promoted really being outdoors and doing things, especially in an active manner like that. But other things outdoors, such as we've seen people go to the beach or be out at the pool or just sitting in the park having a picnic. I think we've always encouraged that.
Yep.
Obviously, we'll say wear your sunscreen because we want to keep our dermatology colleagues in the mix as well. But be safe that way. But I think we've always really promoted and said that it's okay to be doing things outdoors, just as Dr. Williamson said. I think it's maybe at the very beginning or at the end of those where people can tend to congregate fairly closely together. But I think even in those situations, you can still do that safely if you can still space 8-10 feet apart from people. I think you should be fine.
Yeah, exercise, sunshine, that's good for your health too. So keep that in mind. Okay, let's talk air travel. Air travel and planes have proven to be pretty safe, it seems, but are we noticing a change in the effects of mass travel now that Delta has arrived? Have we heard anything about that?
There are so many confounding factors. I think it's hard to point at any one thing as being a big change. I don't. My personal and Dr. Hawkinson's weigh in. I don't think travel has had a big impact because that is being done very safely with masks, and we know that the air handling systems on airplanes, for example, are very good. So I think it's more the change in Delta. Delta is different, and again, if I worry about anything, I worry about either indoor events or very large gatherings.
Well, if social media is positive in any way at all, it's nice when people call out people on airplanes that aren't wearing masks. I mean, really, the airlines haven't tolerated much, have they, Dr. Hawkinson? Because you've been traveling really since this started here and there, and your masking and your eyewear, that's never really changed for you, and you felt pretty safe, right?
Yeah, exactly. Even, once I go through TSA, I tend to put on my eye protection as well. But luckily, in those federal areas, you need to have the mask on the planes. The airlines have been very good about that. Wear your mask. I would encourage everybody to get some sort of eye protection as well. I think that just adds another layer of protection. And then, so certainly doing that. Once you get out of the airport and you're outside, go ahead and take off your mask and your eye protection. But for that traveling, whether it is air travel, train, bus, masking and eye protection are very important and will increase your risk, increase your chance of being protected and not getting infected by by SARS-CoV-2. Specifically, Delta right now is the predominant variant going around.
Dr. Williamson, do we know what percentage of Kansas City area hospitals are Kansas City area residents?
It's a great question, and I've not seen data on that.
Okay.
My gut feeling is that the majority are still Kansas City residents with some mix of, patients who've been transferred in from other areas, but I've not seen that data.
Okay, we can check on that, but I mean, is it safe to assume that because we're, pumping the brakes on the transfers, that we're taking people locally? Is that what that means?
Absolutely. So any given day, we have maybe 180 admissions, and if 14 of those come through the transfer center, I think it's fair to say, or 20, I think it's fair to say that the bulk have come from the Kansas City metro area.
So do Kansas City residents get priority then? If like there were two people that needed to be here and somebody's coming from far distance and someone lives here, do we get priority?
We don't look at it that way in terms of, where do you live? The other thing people ask, which I think is fair, do we prioritize vaccination over non-vaccination? Mm-hmm. No. We look at every single patient individually and go, are they getting what they need where they're at? Sure. And can we provide it, and do we have the capacity? And so we really try to not focus on anything else above and beyond that.
Dr. Hawkinson, anything to add?
No.
Okay, I have one for you, though. What do you say to people who've had COVID and insist their natural immunity is all they need?
Yeah. The guidance continues to be, even if you had COVID-19, you should still get vaccinated, especially if you had COVID-19, say, before the turn of the year, maybe before Alpha became prevalent, maybe before Delta became prevalent. That boost, if you will, that you will get from being vaccinated will continue to expand those B cells and T cells and specify and create even more specific response and robust response to SARS-CoV-2 should you come into contact with it again. Because we do know and understand that people who have a more mild disease compared to those who had more severe disease may have decreased antibody levels. Therefore, maybe they won't have as much protection. How long does that overall protection last? Again, we know that your body will still make those memory B cells and T cells, but getting vaccinated will help boost those responses and those specific B cells and T cells as well.
Dr. Hawkinson, do you think the big vaccine clinics will start to open back up again? You probably hope so, right?
I think we hope so. I think that, again, the more people we can get vaccinated, whether you've had COVID-19 in the past, whether you haven't, the more people that we can get vaccinated, the better off we will all be. The better off you individually will be, as well as your family. Because we know that the more people that are vaccinated, there is an indirect effect of impacting and helping those who are unvaccinated or unable to get vaccinated as well, by just overall protection throughout that community.
Yeah, and to build on that, we've are opening back up a smaller version of our vaccine clinic here on the main campus. Part of the ongoing challenge is staffing for all hospitals to put on those really big vaccine clinics like we had before. We know there's going to be a need as additional boosters are out there, so we will. I do think you'll see some resurgence of vaccine clinics, but it may not be at the same level that we saw very early on when vaccines were available.
Well, that's what I was going to say. Do you think it's more people wanting the booster than it is getting their first shot?
Yeah. Now, we have seen with the increase in cases, we're seeing, particularly I heard in Oklahoma and somewhere else, maybe Louisiana, I forget, we're starting to see an uptick in first dose vaccination, so that's great. But I think it's probably going to be more boosters than first dose, but absolutely hope that it's first dose as well.
Absolutely. Okay. So this viewer says, I've been seeing articles that this pandemic is shifting to an endemic. Is this true? Would this be for the better or worse? Doc Hawk?
Yeah, I think here it's all going to be speculation and expert opinion. But, seeing what we have over the past 18 months or so, and just understanding how coronavirus spreads, how easily it spreads from one person to another, I think that, it will be global, and I think it will continue to be in our communities in some manner for the foreseeable future. Now, what is that? What does that look like? I think that all depends on our behavior as a community or whatever community you may be living in. And by that, I mean how many people are going to be vaccinated. What we have continued to say now for the past several weeks, especially with the surge in Delta variant, is that this is really becoming a pandemic of two populations, and that is unvaccinated and vaccinated. So I think we have to understand that, and what do we want that to look like? If it's a pandemic of the vaccinated, and if everybody's vaccinated, then you will have overall more health in your community. You will have less hospital capacity issues. You will have less businesses shutting down or quarantining because people are out from work because they are too ill from COVID-19. So I think for the foreseeable future, yes, coronavirus will be with us in some manner, but what do we want that to look like? And I think that breaks down to every individual and every community to really understand how they want that to go. And I don't know if Tim has any comments on that either.
Yeah, I think that's absolutely right. And very early on in the pandemic, one of my patients was in the ICU with H1N1. And if you remember back many years ago, that was not nearly the level of concern COVID has been, but it became endemic and not the threat to the community that it was at the very beginning. And she did fine. She got through it. And it was just a little bit of a reminder to me that we can get through this, and this can become something that's more in the background, but that that there is hope on the other side of this.
But we are not there yet.
We are not there yet.
Okay, so last follow-up question, Dr. Hawkinson. If I can smell through my mask, does that mean it's not working? Should I double up?
No, I don't believe so. Again, the main issues from CDC guidance of anything about double masking consists of a surgical mask covered by a cloth mask. That is what was tested. That is what they recommend. But really in their recommendations is that you have a better fit of the mask, whether that's a cloth mask or a surgical mask that you can buy at the grocery store or the pharmacy, or even any of the K95, N95 masks that you can buy out at other places like the hardware store. So I don't believe that just because you can smell through it, that it means that it's not working. Again, what we're talking about are those respiratory droplets. We don't want to get into semantics about size, but just understand that those molecules that you're smelling from, whether you're outdoors and you smell fragrances of plants or anything, or if you're cooking, remember, those are much, much smaller than any of the droplets that may be collected or filtered out by that mask. And certainly, Dr. Williamson, with his expertise in pulmonary medicine, may have, again, more thoughts on that as well.
My only thought is actually a very simple one, and as make sure it's over your nose. I can't tell you how nuts it drives healthcare professionals to see it firmly protecting your chin. And so unless, it not only over your mouth, your nose is also connected to your lungs, mouth and nose, and that's where you're going to get your impact.
Yeah.
So
I think
just
that's
looking at the picture
a
there.
good point of clarification.
Yeah, there you go.
We're not talking about chin diapers here. We want the mask over the nose and under the chin.
Yeah, so,
if you're going to have that on, have it on right if you have to wear it, right? And you've always said, wear it right, and just please, people, wear one mask. We'll take one mask.
Yeah,
We're not even asking for two.
We'll take one mask. People, get your first dose of vaccine before we have to worry about additional or third dosing. So it's pretty simple.
Very simple. Okay, so those are our follow-up questions. My girl Marcia is grabbing some great questions from all of you offline this morning, so I'm going to just jump in with those right now. Okay, so Sean wants to know, Dr. Williamson, what type of patients do other hospitals need to transfer here to our health system? What kind of patients?
Yeah, I think it totally depends on the size and capabilities of that hospital. So a critical access hospital that may have 4 beds and no ICU, they have to transfer quite a bit of stuff, heart attacks and people who need more than a certain amount of oxygen, or anyone on life support. Other large hospitals in the metro area may just only need to transfer if they need ECMO or that heart-lung bypass and don't have it themselves. So it really depends on the size and capabilities of the hospital that's asking.
And do we know if the bulk of transfer patients are COVID or other care, or is it a mix of both? You never know.
It's a mix. I would say, and interestingly, when I talk about those transfer requests from all across the states, they're not necessarily COVID. Some of them have been GI bleeding, or heart attacks or other things. So it's a mix, and I wouldn't even say COVID is probably the majority of it, but it's certainly a fair amount of it.
But COVID increase in other areas is bumping other people out.
Absolutely, and so you think currently we have 90 patients, including our acute and our recovered patients. Those are 90 beds that are being occupied by patients with COVID that other illnesses can't take advantage of. So.
Amy asks, she says, I've been tracking the COVID pandemic because of my job. Most of the U.S. is red, but Nebraska, we brought this up earlier this week. What's going on with Nebraska? It's green. Yeah. What are they doing that we're not? Why is this? Is this a lack of reporting, high vaccination rates? What is up with Nebraska?
Dr. Hawkinson and I are both laughing, but it depends on the heat map. If you look at the New York Times heat map, it's white except for a couple of dots. And to my understanding, there has been really a mandate that only counties with 20,000 or more residents report. And so that's not a lot of counties in Nebraska. And so you're seeing primarily the metro areas like Lincoln and Omaha reporting. And I don't know, do you have other?
Yeah, I mean, I think that the professional medical answer is it's not a medical issue. It's more of a reporting political issue.
So we shouldn't all relocate to Nebraska.
We shouldn't move to Nebraska right now.
And this was really impressive. For those of you who have followed this heat map, it started off fairly light yellow, and it was like a drop of ink was dropped kind of in south central Missouri, and it just spread down through the states that you see there.
Yeah, we've been pulling this up daily. It's pretty concerning. Joanne asked, what do you tell people that say people die every day? Is COVID being overblown? No.
No. Thank you.
Yeah.
The short answer is no. Yeah, people die every day. What we don't want is preventable deaths. And we know that virtually now COVID deaths are preventable. And we don't want that. And it's not being overblown.
Dr. Hawkinson, what are your thoughts that people think this might be overblown?
Yeah. I mean, I think that we have very good evidence about the excess deaths that have occurred since the time of the pandemic due to COVID or COVID-related mortality and death compared to other years prior to the pandemic, and that absolutely would not bear out that statement. But also, I would like those people who say that to be consistent in their thoughts as well. If they're saying, well, deaths occur every day, well, but a lot of them are also probably saying, I'm not getting the vaccine because somebody died within 2 days. Well, if you understand that, there are thousands of people that die every day, whether they get the vaccine or not, and the vaccine had nothing to do with it. So we just want some consistency in what they're saying and what they're thinking. And if they are not going to get the vaccine because they think they're going to die, well, that's not consistent with their thought that people die every day, because they've seen some reports of people who died within a day, within 2 days, within 5 days of getting the vaccine. But we know that's going to happen in America because we know the population that we have. There are so many deaths every day, or so many deaths within 5 days of getting the vaccine that has nothing to do with the vaccine. So I think it continues to be what we're seeing, and people kind of talking out of two sides of their mouth and not being consistent in their thoughts and in their words. But the answer to that is no. There have been very good reports and data that show the excess deaths that have occurred because of COVID-19 that wouldn't otherwise have occurred if it wasn't here.
Okay, I have a few questions about kids. And Ashley has a question. I don't know if either of you know, but I have to ask because it will lead into a couple other questions. But do we know the ages of the patients being hospitalized at Children's Mercy? They know they go up to 20, 21 years old, but I mean, are they seeing it under 12 that have not been vaccinated, or is it those being vaccinated? And she will be on Monday to answer that, but I just didn't know because...
certainly we're seeing throughout the country kids down to the age of babies who are being hospitalized with this. And of course, currently kids under the age of 12 can't be vaccinated. So I don't know the numbers at Children's Mercy. It will be great to get those on Monday. But it's clearly being seen throughout the country.
So Rebecca says people's kiddos are popping up sick and parents are instantly testing them and getting negatives. So should they just be keeping their kids home or waiting to test them to see if it's a positive?
I think and Dana can push back if he disagrees. I think testing's good because we want to capture that, and often they're being tested for more than one thing. It's RSV or other viral illnesses. But we want to know so that we can have the proper containment measures in terms of quarantine and isolation and stuff. And so I think testing is absolutely good.
Yeah, I do too. I absolutely do. I think what we saw earlier on with the ancestral strain of SARS-CoV-2, now with Delta, I think the consistent messaging there is that you really do have the highest viral loads from 1 to 2 days prior to any symptoms to 1 to 2 to 3 to 4 days after symptoms start. So if you do go get tested, once you start having symptoms, you will have the highest chance or the highest sensitivity for becoming positive. So I think testing is good and continue to do it. I am certainly thankful that my children are of age to get the vaccine. They have gotten the vaccine. But I think overall, yeah, if your child has symptoms, understanding what the spread of COVID-19 is in our community, they should absolutely get tested when they do have symptoms.
And I'm very thankful. I just want my kids also both vaccinated.
Yeah.
But that also prompts another comment of just please, 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 if your child is sick, please don't take them to childcare or daycare or school. And if you're sick, please don't go to work. And we have seen starting to see some outbreaks in the community in daycare situations. So, underscore, please don't go anywhere if you're sick.
Okay, I'm only bringing this up because you both brought up your kids, and I know neither of you are clinical psychologists, but I'm going to ask you this anyway. Jennifer says, are children emotionally damaged by wearing masks in school? I don't think so, but some people in her school believe so. I know you two can only speak from your own dad experience. Are your kids psychologically or emotionally damaged by wearing masks?
That's not true. How
are your kids doing?
They're good. They're resilient, and they've managed this whole pandemic in just an amazing way. And we talk to a lot of different folks who are parents of all different ages, and their kids are doing fine with the mask. Of course, being home during the time that they had to be home was tough, and not doing some of the activities for when they couldn't do their activities was tough. But in terms of going to school wearing a mask, I think most kids are, from everything I've heard, are doing
Dr.
just
Hawkinson,
fine.
Do your kids seem emotionally different because you make them wear a mask?
No, and I would agree with Tim, certainly. The question was, and it was stated as a lot of parents think that their kids are emotionally harmed by this. It's a good opinion and a good thought, but that is not supported by the consistent evidence nor the consistent messaging from pediatrics groups, whether that's the American Academy of Pediatrics, psychology groups, psychiatric groups. That certainly would not be supported by the consistent evidence and data that children are harmed by mask wearing. Again, I think if you ask me, they're going to be more harmed by continuing to have to be home, quarantine, doing online learning, and being isolated than they are wearing a mask and being able to interact with their classmates at school. And again, once you're outside on the playground and you're doing those things, I don't think you need a mask on at those situations, but certainly in the classroom. So the ultimate answer is no. I don't think there's any harm psychologically. More harm comes from when they are isolated at home.
Back to that American Academy of Pediatrics, they are the experts in kids, and they are experts of keeping kids safe, and they recommend masks and vaccines. And I think keep coming back to them. These are, 70,000 people who are experts in kids, and entire focus is keeping our kids safe, and so we should listen to them.
And I'd like to piggyback on that. I was in a meeting last week about mask mandates for certain groups. And I said, there is no group who cares more about children and does more research and dedicates their life and time to keeping children safe than the American Academy of Pediatrics. This is what they state masking should be done. One of the people said, well, I know some group that doesn't care as much or cares more about their children than anybody, and that's the parent. Mm-hmm. Yes, but that parent just cares about that child. The American Academy of Pediatrics and those pediatric groups care about children's health as a whole. So again, they dedicate their life, their time to creating and focusing on the safest plans, protocols, and measures for children overall.
Thank you both for that. Okay, so Chelsea wants to know, if someone wakes up with upper respiratory symptoms that mimic allergies, then they resolve those, but then the next day they have GI symptoms. Should they just isolate themselves, or should they go ahead and be tested? I think people are now like, do I test? Do I not test? What are we doing with testing? Everything gets tested?
Yeah, I think that's the safest thing to do. We just heard, Tim say, if your child does have symptoms or you having symptoms, please don't go to work and spread it. There is ready testing available all over. There is good access to testing, whether it's at private pharmacies or minute clinics, whether it is at private clinics. Certainly here at the health system, we have ready access to testing. I think if there is any question, please go get tested.
Anything to add, Dr. Williamson, as I'm looking for another great question?
No, I think that's right. And there's even home, I don't
Yeah,
there's even home tests now that, so for those kind of, is it allergies or not, maybe that's a place for those.
Okay, a couple more questions. Isaac wants to know, watching the Johnson County Commissioner meeting yesterday, I saw new case numbers in the region appear to be leveling off. How soon will this translate to hospital numbers?
Great question.
It's a great question, and we don't necessarily know if Delta will quite follow this, but in general, the hospitalizations have followed case numbers by a couple of weeks, and in general, deaths have followed hospitalizations by a few weeks. So, we love seeing leveling off of case numbers if that truly is happening, as long as it's not because we're doing fewer tests. And sometimes we've seen that as well, that we're not doing fewer tests. But in general, hospitalizations follow a couple of weeks after cases.
Yeah, I would agree, and I think we've said now for the past 4 to 6 to 8 weeks, really because of the point that Tim brought up, because people aren't testing maybe, I think the real bellwether is going to be, what do our hospital numbers look like? So hopefully we will start to see a trend at some point fairly soon, certainly sooner is better than later, of a plateau of hospital active infections, and then of course that decrease. We'd like to get down to 2 like we were recently, but I don't know when that will happen.
All right, Jessica wants to know, why are the CDC's quarantine guidelines not updated to reflect Delta's transmissibility? Just fewer minutes, closer contact versus 10 to 15. Why not, since vaccinated can now transmit?
Yeah. Again, I'm not clear on all the virology and the science behind some of this issue about transmissibility, about 2 to 4 minutes versus 15. I think it's all a matter of, we shouldn't really get into semantics, but if you encounter a large viral load, whether you're in a small enclosed space with somebody who may have it, such as a small room in a restaurant, you don't need to be in there for 15 minutes. Obviously, if they are in that pre-symptomatic or early stage, they can still transmit a lot of virus. So I don't think we really understand the science, and that isn't necessarily what is guiding the quarantine. I don't think we need to see an updated quarantine rule. I think if you are quarantining because you have been exposed, then you really should develop symptoms within that time. But again, we also know that the guidance for quarantine allows you to test after a certain number of days to get out of quarantine a little bit earlier. And certainly we know now that if you are exposed and you're fully vaccinated, it is recommended to go get tested 3 to 5 days after that exposure as well.
Okay, a couple quick ones. Is it safe to get a haircut? Now, keep in mind, this is the Delta is different mindset. Marilyn says her and her stylist are both vaccinated, but no one else has a mask on. So how do you know who's got what, who's vaccinated? What do you do? What's your recommendation?
I need a haircut, but I think it's safe if certainly everyone's vaccinated and you're wearing a mask, and ideally your stylist is wearing a mask. And so on the Missouri side, I think there are many places do have the mask mandate, and the stylists are wearing them. But I think it's perfectly reasonable to ask your stylist to put on a mask.
Yeah. You got your hair cut the other day.
Yeah.
What did you do?
I mean, is it safe? Depends who's cutting your hair and if they're mad at you or not. But I think what we saw early on from some of those early reports was that when you have both parties that are masked, the stylist and the client, that really there is a significant reduction in the ability to transmit that disease to that other person. So I think if you and your stylist can both be masked, yeah, I believe it's safe, especially if you're vaccinated. It's unclear whether this is a setting where it is a larger area where there are other people in there. Certainly she asked about if other people in that area are not masked. It may be a little bit more risky, but certainly I think if we're talking about just the relationship with you and your stylist, if you are both masked, that is certainly, I believe, a much safer environment and a safer scenario there than if just one of you are masked. Or, if you can get to that area where just the two of you are, where there aren't other people who are not masked, that would certainly be safer as well.
Really, really quick. A lot of times people frame this as safe or not safe, and it's a continuum. It's how many layers of protection can you put in there? How safe can you make it in the continuum?
So you're not growing your hair out? That's something to do.
I'm not. I'm not going for a ponytail or mullet.
No man bun for you.
No man bun.
Okay, so Craig is going to get the last question, but again, I just want to remind everyone who have questions about their kids. Angela Myers from Children's Mercy will be on Monday, so we will save some of those questions, and I'll hold on to the other ones to get to next week. Okay, so Craig is asking a question that we've talked about before, but Dr. Williamson, I want to get your thoughts. If vaccinated people can still catch and spread COVID, is it safe to say we just simply cannot reach herd immunity? It's such a good question. I get why people ask it a lot.
Yeah, and Dana may actually be able to approach this better. So I don't know that we'll ever get to the point where herd immunity eradicates COVID. We can get to the point, though, where we can safely operate, in a new world where everyone's not having to wear masks, et cetera. So I think whether we get to what we initially were calling herd immunity to the point that COVID goes away, probably not. But can we get to a place where enough people are vaccinated that everyone is safe? Yes, I think we can.
Yeah, I would agree. I mean, I think it goes back to more of that population issue, and that's what we're talking about with herd immunity or population immunity. What are we looking to try and do? Are we looking to stop infection? I think it's very difficult to stop infection. Infection is really just that virus coming into contact with your cells and causing an immune reaction in your body, essentially. So what are we looking to stop? We are looking to stop the whole spectrum of COVID-19 disease, but especially that disease that sends you to the hospital, that keeps you in the hospital for 10 or 14 days, that puts you in the ICU for severe disease. So I think in that way, yeah, we can get back to normal. That's what vaccine is doing. The vaccine continues to provide good protection for you against going to the hospital, severe disease and death. We know obviously that is okay, and that is what we're looking for as far as efficacy, and that is why we are using the vaccine, is to protect against that, so that our hospitals are not overwhelmed, so that we have beds when you come to the emergency department for a heart attack, or if you fell and broke your leg, or a stroke. Those things that we have normally treated, now that we find it hard, or a lot of hospitals, as we have heard, find it hard to treat because they are overwhelmed with COVID-19. If you are otherwise needing a ventilator for some other reason, they aren't all taken up because of our COVID-19 census. If you're needing those vital drugs that aren't all taken up because of capacity issues and drug shortage issues because of COVID-19. So that is the goal of the vaccination. And the vaccinations, even at this time point, continue to protect us against that. And that's why it is so important to continue vaccination, as we have just seen, and continue to give that message that the vast majority of the people here in our community and also around the nation are unvaccinated for going to the hospital. So please continue to get vaccinated. We know that with vaccination, we can overall reduce our hospital numbers. We can overall keep the community healthy. And we know that when the community is healthy, we can continue to have a healthy economy and continue to do those things that we'd like to do.
So I hear you both saying that through the vaccine, we can have a time where we hear of a COVID death is very, very rare, correct?
Absolutely.
All right. Dr. Williamson, I'm so glad you sat with me today. Good to see you.
Thanks for having me.
But I want some of your final thoughts before we head into the weekend.
Yeah, absolutely. So we're seeing two things. We're seeing a healthcare system in crisis across the U.S. and in the metro region as well. And we're seeing preventable hospitalizations and deaths. And when we talk deaths, these are not, I'm not meaning to be morbid, but these are not quick deaths. And these are in younger people, and they're protracted weeks in the ICU without your loved ones. This is not, and these are preventable. And so we just cannot stress enough, please get vaccinated, please wear your mask, and not only for yourself, but for your kids, for your kids, for your family. And then we can get to a point where we're keeping our economy open, we're getting back doing the things we want to do.
Right, and it's not morbid. You're just keeping it real. We appreciate that. Thank you, Dr. Williamson. Dr. Hawkinson, send us out into the weekend with some words of wisdom.
Yeah, go get vaccinated, and if you can, like we said, spend time outdoors, whether that's walking or running in a race, going out to the park. Enjoy the weather while we can, and please, keep yourself and your family and your loved ones protected.
Thank you both, as always, and thank you all for being with us on this Friday. We know that Delta is different, but how does it impact our children? We know a lot of you have questions. So we are back on Monday with Dr. Angela Myers from Children's Mercy. We're going to answer your questions and concerns as children are back in the classroom, some masked, some not, and the challenges we face as COVID cases continue to climb in our area and our region. That is Monday starting at 8. But we leave you with this video, a reminder of exactly what we have been talking about this morning. Delta is fast and furious, and it's affecting hospitals, patients, and staff across the country and right here in Kansas City. So please stay safe this weekend and get vaccinated.
The Delta variant is just so much more transmissible. I mean, at the end of the day, this is a different disease. We got calls from Mississippi, Georgia, Arkansas, Louisiana, Texas, New Mexico, Oklahoma about taking patients. But we can't take anybody. I think we're in trouble. I said once before last fall that we were on fire, and I think we're on fire again. And I think the problem is that we don't have enough people vaccinated, and then folks are not following the rules of infection prevention and control.
This thing comes on like a freight train. Where before it took us 5 to 6 months to get to these high levels we saw last winter, now it's taken 5 to 6 weeks. This thing moves quickly through a community, and it's very, very dangerous. But the spread is largely in younger people. You go through these ICU units, and unlike last winter, where you saw mostly elderly folks, now you're seeing people age 18, 20, 25, 30.
We're going to have to take control of the mitigation steps, whether that's face masking, whether that's getting the vaccine, whether that's social distancing, when appropriate, getting everyone to really take this seriously so that we can get this under control.
I don't think we're getting enough traction out there. It doesn't feel like people are really listening. They got so much COVID fatigue that all the desire to pitch it at the beginning, people are just tired of it. But I tell you what, if you want to see tiredness, you want to see exhaustion, go look in the eyes of the nursing staff right now.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.